Knock, knock.
Come in.
Hey, how are you? My name's Carly. I'm going to be your nurse today. Alrighty, providing privacy, doing hand hygiene. Alright, can you confirm your name and date of birth for me?
Emily Coyne, May 9th, 2006.
Okay, so we're just going to be doing a few assessments on you today. That just includes vital signs, doing a respiratory and cardiac assessment. Does that sound good to you?
Yes, ma'am.
Alrighty, we're going to start off with your blood pressure. Do you have a preference on the arm?
Yes.
Okay. And do you know if you have any allergies?
I do not.
Okay. And are you taking any medications for your heart?
I am not.
Okay. Alrighty. Do you know about what you run high-low, about normal?
Normal.
Normal. Okay. And just breathe normally for me. Okay, 121/79 is that blood pressure. Okay. Alrighty, and now I'm going to assess that pulse, okay?
Alright.
And like I said, just breathe normally for me. Alrighty, that pulse is 75 and that respiratory rate is 20, okay?
Alright.
Alrighty, and are you in any sort of pain today?
Yes.
Okay, where's that pain located at?
It's in my chest.
In your chest, okay. Is it pretty localized or does it
Yes.
radiate anywhere else?
It's right in my chest.
Okay, alright. On a scale of 1 to 10, 10 being the absolute worst pain you've ever felt in your life, how would you rate that?
About a 4 or 5.
4 or 5? Okay. How does it affect you? Does it inhibit you from doing anything in your daily life?
Just like lifting things and some major exercises.
Okay. Alright, and is there anything that makes it better or worse?
No.
No, there's not? Okay. Alrighty. And do you know the quality of your pain? Does it throb? Is it like a stabbing feeling? What does it feel like?
It's kind of just a dull pain.
A dull pain in your chest.
Yes.
Okay. Alright, now we're going to do your respiratory assessment. Like I said, your respiratory rate was 20 and you didn't struggle with that breathing and your rhythm was pretty normal, okay? And now I'm going to listen to your breath sounds, alright?
Alright.
Okay. Alrighty, right here I am listening to, and just breathe normally for me. Every time I touch the stethoscope to you, just take a deep breath in and out, okay?
Okay.
Alright, right here I'm listening to your right upper lung. Okay. Left upper lung. Left lower lung. Right middle lung. Alright, I'm going to listen to your side here. Could you do this for your arm? Yes, thank you. This is your right lower lobe. Okay, same thing on the other side, and your left lower lobe. Okay, I'm gonna come around the back and listen to the back of you. Right here, I'm listening to your right upper lobe, okay?
All right.
Okay, that left upper lobe. That left lower lobe. And that right lower lobe. Okay, breath sounds are really good, all normal. Alrighty. And then I'm just going to educate you on some devices that we use to for your lungs, okay? So the first one that we use is an incentive spirometer. It's a little device that you'll inhale in, and all that does is just expands your lungs, make sure you're breathing good, just exercises them. And you want to do that about 10 times an hour, but not all at once because it can make you a little bit woozy. Okay. And then we also do the turn, cough, and deep breathe method. We want to do that about once every hour or two. What that does, we literally turn you on your side. You're going to cough and deep breathe, and that just gets rid of any secretions and make sure you're getting a good breath of air in there, okay?
All right.
And are you having any shortness of breath or anything like that?
When I do like extreme movements.
Extreme movements? Okay.
Yes.
Alrighty. Next, we're going to do that cardiac assessment. I'm going to look at your jugular vein. Could you turn to your side like that for me? Alrighty. Jugular vein is distended. That is good. And now I'm just going to palpate a few pulses for you, okay?
All right.
Alright, first I want to point out that you have a carotid artery right here and a carotid right here. Then you have your axillary ones on each side. And you have your brachial on each side. And now I'm going to feel for your radial pulses, okay? Okay, that rhythm is regular, and I rate that 2+, okay?
All right.
All right, and then you have your femoral pulsats right here on you, okay?
Yes, ma'am.
And then you have your popliteal back here behind your knees, and then I'm gonna feel for your posterior tibial pulses, okay? All right, just feeling them both at the same time here. Alrighty, those rhythms are regular, 2+, and now I'm feeling for your dorsalis pedis pulses. Alrighty, those rhythms are regular as well, 2+. And now, can I see your hand? I'm going to assess your capillary refill right here on that nail. Okay, 4 seconds. That capillary refill is more than 3 seconds. Alrighty, and then now we are gonna, we're gonna listen to your heart sounds, okay?
Okay.
Alrighty. And just breathe normally for me. I'm just listening to your heart. Right here, I'm going into your right second intercostal space, listening to that apical area. Okay, S1 and S2 are present. Now I'm going into your left second intercostal space, listening to that pulmonic area. Okay, S1 and S2 are present. Now I'm moving down to your left third intercostal space, listening to Erb's point. Okay, S1 and S2 are present. Now I'm moving down to your fourth intercostal space, listening to the tricuspid area. Okay, S1 and S2 are present. And now I'm moving down to the mitral area, listening to your point of maximal impulse. And I'm going to listen to that one for about a minute, okay?
Okay.
Alrighty, and that's going to be right under here. Everything sounds good there. Your rhythm is regular. And S1 and S2 are present. There are no extra sounds like S3 or S4. And if there were, in that case, I would listen to the bell. Or listen to you with the bell for listening to those extra low pitch sounds. And then I'm going to check you for some edema on both of your lower and upper extremities, okay?
Okay.
Alrighty. Can I see your foot here? Alrighty. Okay, no edema present on that one. Let's see about the right one. Okay, none there either. Can I see your hands? No edema present there. And no edema present there. Okay, and lastly, are you having any sort of chest pain, shortness of breath, or any pain like around your chest area?
Yes.
You are? Okay, can you tell me a little bit more about that?
My chest just started hurting. It's a dull pain in my chest area right here.
Okay, alrighty. And then I completely forgot to ask, when I first asked you if you were feeling any pain, how did that start? When did that start?
It started yesterday.
Yesterday,
In the
okay.
evening.
Okay, and is it all the time or just intermittent?
Yes.
Is all the time pain?
Yes.
Okay, well that's all I needed from you, and I will make sure to let the provider know everything we found today, okay?
Sounds good.
Alright.
Thank you.
Yes, ma'am.